right, my friend. Tell me, I know you've kind of been through the whole DTR process, at least what this is the third visit?
So the fourth one.
Fourth visit. Okay. So you were originally diagnosed with what?
Trigeminal.
Trigeminal pain. Trigeminal neuralgia?
That's no.
Yeah, okay. So I just for the sake of, a patient testimony on kind of what your experience was, like what did you experience? What are you running into? Where are you at now? What have you tried before, kind of a thing? I just want you to tell your story a little bit.
Like it started about 12 years back.
Okay.
And I was all over the world, try all over dentists, all over neurosurgeons and everybody. And I went through 3 procedures, gamma radiations and 2 more procedures, and nothing worked. So you can say last 12 years, my life was terrible. I can't concentrate, I can't sleep. My son-in-law, he found about you, and when we were here 4 months back in November or December.
Sure.
And in the third procedure, after the third procedure, the pain was down to 2%, 1%, 3%. And now I'm kind of back to normal life, except the medicines.
Okay.
So now my goal is, with your recommendations, how we can reduce the medicines.
Yeah.
That's what, and I recommend anybody in this whole world, come and see you, because I don't think, I wish my son-in-law found you earlier than when he did.
Well, I had your answer, that's for sure.
Yeah, and whatever you did, I don't think if I have another 10, 15 years in my life, I don't think with that pain, I could have lived like that.
Yeah.
I start thinking it's not worth living, Now I'm fresh. I'm ready to move again in my business and everything now.
Good.
Life is good, life is better, and I was talking to my son-in-law. After India trip, I'll go back to my business again and be aggressive. And
Awesome. That's all great news. So I did have another question. You said you had 3 procedures, 1 gamma knife. What were the other 2?
other
But please resolve me the vertebral nerve.
Oh, okay. Okay.
Radio frequency resolving.
Yeah. Okay. She had the radio frequency rhizotomy twice. On the same branch?
Same branch, right?
Same branch. Okay. All right. Wow, you're having quite the results. This is awesome.
Yes, but one thing I regretted in my life, I went all over. I paid like lots of money, 15 minutes, $350, this and that. Nobody could diagnose. That's my regret in my life. People's very hi-fi, either dentist or neurosurgeon, how they could not even diagnose what is the real problem. Keep on take me to the table, operate on me, and as soon as they finished, the pain was still there. So that is my regret in my life.
Well, a lot of the things we can't, neither dentists or doctors can see your pain. So I think this is a great adjunct. And I've always maintained that before patients get onto the operating table, right? Should we rule this out? Because like you said, if somebody, the first doctor you went to said, hey, we need to rule this out first, because this could be what the source of pain is. Well, yeah, you would have had the answer long ago, right? But I mean, you got the answer now, right? And so, yeah, we'll pat him on the back.
He's the one, because if he didn't find about you, life was kind of not worth living. That's what with me.
Yeah, no, I totally get it.
It's not like whatever happened for me, it was like that. You're like a god to kind of pursue me. It was not like us really, really, really terrible.
Well, I'm glad you're getting some great relief.
Really, yes.
And to be, 95% rid of the pain is amazing. So let's talk about one of the questions that you asked was like the next step is I want to get off the medication.
Yes.
Okay. So I generally like to have, 2 or 3 months of really solid, hey, I feel good. This thing isn't oscillating pain anymore. How do I come off of this? And the doctor that prescribed the medications is going to take you off because a lot of the medications
No,
are
doctor,
pretty
one,
nasty.
no, doctor, one thing, they don't know anything about this one. My family doctor, we can decide better, me and my son-in-law, but my family doctor, they don't know. They don't know. Whenever I go to them, all they said, okay, decrease it, but they don't have any knowledge about this one.
Okay.
So my only thing is whatever information I get it from you, I want to follow that.
Yeah. Well, I gave you my official recommendation is the doctor who puts you on the medication
Yeah.
is going to take you off. And they generally do that in half-lives. So let me explain the reason why. Because your body is expecting that medication to be there. And if you're just like, I'm going to cold turkey stop it, I promise you're going to have a massive flare of the pain. That I've seen over and over and over again. So don't get too comfortable with the fact that, oh, I feel good. I'm just going to come off all the medication. Don't do that.
No, we won't.
Yeah. You need to come off of this in half doses and be at that dose for 4 to 6 weeks, then half and again. That's not my official recommendation. That's generally what I observe when doctors are taking patients off the medication, especially these types of medications, right? So, yeah, we're going to continue to follow up. I appreciate the goodies you brought me from Canada.
Some doctor,
Yeah.
doctor, this is something to say thank you.
Yeah,
That's
well,
what it is.
it's a blessing. I appreciate it. Hey, were you watching the Olympics? Did you watch the
Yes.
Olympic hockey team?
Let's not talk
Yeah.
about that.
You don't want to talk about that, huh?
Yeah.
Well, we won't talk about the men's hockey team. What about the ladies hockey team?
We won't talk about that.
We won't talk about that. Hey, you guys came out pretty good in curling.
Yeah, of course. Yeah.
You got the gold in curling. That's good.
You guys did better than us this time.
Oh well, we have the benefit in that we take the best from the world.
Yeah, you took our defenseman too, Quinn Hughes, and from Vancouver Canucks, and
Yeah.
he was on the ice when his brother scored. So
Hey, well, I can't remember what her name was, but there was a great Chinese figure skater.
Yeah.
She skated for China, and they won the gold.
that's really what.
Yeah, I mean, it's like, yeah. I don't want to get into the politics, but yeah, every country should be representative, and
Yeah, it's good for the sport for sure.
I think it's great for all the sports. Yeah, for sure.
And Dr. Bankochan,
Yeah.
Tagra told, I was like last 6, 8, 10 years or 4 years, I was normally taking 2 to 3 Tagra. But the pain was very, very severe. I added half. Now I'm at 5. Is it possible after 4, 6 weeks I take half?
Yeah.
No,
Like
Yeah.
4.5.
4.5.
It would be 4.5. 6 weeks later.
6 weeks later, something like, yeah.
6 weeks later, 3.5. We're gonna do it very slow.
Yeah, that's fine.
Yeah.
This is a smart way to do it.
No, I know. He's the one. I'm here. We are here because of him. He studied a lot about you.
All right.
He studied. He believed me.
We'll give him an honorary DTR degree.
Even if I have to go third world in the somewhere else in Korea, somewhere I'll go.
All right.
Because doctor, this one, like but believe me, in this one, it's not worth living with this pain the way the pain was.
Yeah.
I was living. I went through because of my commitments, my other thing, but otherwise.
So now he's like I've observed, it's been about a month of, I'd say, like he's been saying 95%. He even said 99 one time. Cool, but I'm like that means nearly nothing. And so I asked my mother-in-law, geez, he hasn't take on my daughter as much. I know we just want to jinx things either. But, he went through extreme stress in the last 4 months. Then I asked, how are you progressing through this event? And it was a pig. Like, you'll feel like something trying to come on, but it is at the
Yeah,
Yeah.
that's what happened, doctor.
So
this is about to trigger, and then no.
yeah, that's what we see is that, and it's not just in trigeminal neuralgia, but in Meniere's disease and other things too. The people will get the aura of the pre-flare up without experiencing the full-on, like the trigger's there,
Yeah.
but the full response of the symptom is not. You see that? That's a good direction to go because hopefully with time, like you won't even get the pre-flare up. I can't say that because I've seen patients that have the pre-flare up and there's a little flicker, but it's nothing like it was before. And then there are patients that have the trigger and there's a little nothing. There's no aura. There's just, hey, I'm aware, and it kind of makes me nervous because I think this is going to turn into a full-on flare.
Yeah.
And then you're kind of like walking on eggshells for a day or two, and then it just kind of goes away, and you're like, okay, and then there's other patients that respond and like they just have nothing.
And what we found was, like, so when we first came in, I don't know if you recall, but we were saying 20% relief would be great. 30% would be success. That's how we were defining success.
Right.
And so our last visit, he was at about 50, 60. And then that was prior to January, right? So we came in January, and that was a 50, 60. The last treatment that he did took it over to the 90s. And when I heard 90, I was like, oh, okay. Like, now let's just follow the next course, what we do, and we'll see where it goes.
Yeah. So today's going to be no different than any other day that you've come in. Like you're already hooked up. I'm going to use the T-scan. We're going to measure, see where you're at.
Sure.
If I need to make adjustments, I'm going to make adjustments. If it looks like it's good, you're telling me 90, 93, 95%. I'm like, dude, you're there.
Yeah, only thing with doctor, what I find within last week or 2 weeks, only just over here, like, no, 12 years back when I was shaving, like you shave just normal. But when the pain was there, this was the part. Only last about a week or 2 weeks, couple of times when I was rough, very fast, couple of times I find it here. And then I slow down. And then it goes away like that.
But what was the intensity? Was it like sharp, as hard?
No, it is just kind of a nerve here, like you touch the nerve. It won't let me touch the nerve. Then I slow down. And then I just went.
So the shape, frequency, duration is less. Like you would.
Oh,
feel
it was
be less
only
pain in
2 seconds, 3 seconds.
Yeah. No, that's a pretty common observation. All right.
But
Any
doctor,
questions?
one thing is,
Oh,
it worked. Whatever you did, 100% it worked. It's not like that that was 99%. I'm here to say thank you. It worked. Everything, you worked very hard. You did it, and whatever you did was right on.
God bless.
Thank you, doctor. Thank you.
All right.
Appreciate it.
Let's get you checked out here.
Yes.